Good afternoon. Welcome. My name is John. This is Heather. I'm a therapist here at CJW Sports Medicine. She is a physical therapy assistant with us. We're going to go through a few taping techniques that we'll be demonstrating in a course next weekend for your purposes to refer back to. The first one is going to be a cuboid sling. Does help with some lateral foot pain that you can establish as a cause the hypermobile cuboid. First, we like to start just underneath of it on the plantar surface, pull over the top, cut our kinesio tape, spider tape. Some people even use tensoplast for it. Other colleagues of mine I've seen use McConnell taping, which is actually probably what we'll be doing in the course. But for this purpose, it's the same, very similar type of tape. I particularly like the kinesio tape version. Pull, palpate, base of the fifth, cuboid, then cover up. Seemingly gives them some relief from that lateral foot pain. Very simple technique, seems to be very effective. From there, we're going to use her other foot to demonstrate a plantar fascia or anterior medial heel pain tape job that we seem to like a little bit better than a typical low dye tape job. First, we want to get their foot, their ankle, into more of a neutral position. Doesn't really need to be dorsiflex or plantar flex. Their first MTP extended so that we give good plantar fascia tightness and get a nice good arch so that we have the foot in a more efficient position. We start from the base of the fifth metatarsal, wrap around the calcaneus, pull anterior medial calcaneus. Second piece, and just create like a little web. What this does is it gives the plantar fascia a little bit of support right at its origin. Be careful not to get too far forward and get into the base of base of the foot metatarsal. I generally use about 4 pieces. I try to split my roll of tape into thirds so it gives me nothing to work with. Then to close it, typically close at the forefoot, pulling up and over on the lateral side. And then I split my cover up so that I don't compress the metatarsal heads as much, and essentially bifurcating it. There you go. Just regular athletic tape that we use is very common in most clinical settings. Alright, that's those two. Pretty straightforward, seems to be very effective for those with anterior medial heel pain, plantar fascia itis. Straighten them in. I'm going to take this tape off. Normally you want to do that, but for demonstrative purposes. Now we're moving on to our Navicular Sling. Navicular Sling is a very powerful taping technique. It's very simple but very effective. I'm going to get her to over the edge, foot slightly plantar flex. I'm going to take our hyperfix, mark just on the plantar surface of her navicular first neck. Pull up till the top edge of my hyperfix is equal to or just past the fibula. Cut our hyperfix. Peel. Palpate her navicular tubercle just underneath. Get my thumb up into there. Kind of flex her. Kind of lay the hyperfix over. Then I take my gluco tape. Mark it. that same support, get her into a little bit of rear foot inversion and pushing her metatarsal up as well as her navicular, and pull my loop into. Follow that up with a second piece. A lot of times we'll start with this tape job. It does do a lot of good things for patients. Sometimes it's not all that they need, especially if we can establish that their midfoot instability is due to a rear foot problem. In that case, depending on what their rear foot problem is, we can influence the rear foot with an inversion or eversion taping technique. Her particular case, she does have a little of lateral ankle instability, so we will be pulling her into a little bit of eversion to help minimize what she feels is a need to pronate through her midfoot. Mark our piece of hypofix. Keep it as wrinkle free as possible. Medially. Up and out. Come and take it, mark it. Take it. Medial coverage. Pull her into eversion. Pull and set. Second piece. Mark it. That will give us an inversion control, eversion influence, so that she doesn't feel like she has to over-collapse through her midfoot. Now there are others who just collapse at their rear foot, they're going to eversion too much, they completely over-pronate, midfoot just goes along with it. Those we would actually set up with a inversion influence to minimize that. So we would mark that off. Our hypofix. Mark it, lateral pulse, pull medially, again with this neutral position. Mark our loop tape. Sometimes it doesn't cooperate. Inversion influence. There we go. That's what, if you were to do inversion, eversion with a navicular sling, we do. Most of the time we do one or the other, but generally include the navicular sling. Want to stand up? It does demonstrate pain relief for her when we do this.